gallbladder disease. What are the other older names? This has also been known as gallbladder dyskinesia. You must have heard this name. It is known as gallbladder dyskinesia. Older terms, I am talking about the older. All these terms have been replaced by this. So this is very, very, very important. The old terms are we have gallbladder dyskinesia or gallbladder dysmotility disorder. There are a lot of names we have. Along with that, some people used to say acalculus, gallbladder dysmotility. Lot of names are there. Let me forget about them. Now the new name that you will be remembering is the functional gallbladder disease. So ये होता क्या है? What is the concept of this? So whenever there is a release of cholecystokinin, everyone knows that whenever there is cholecystokinin released, so cholecystokinin release will cause relaxation of the sphincter of Lutkins as well as the ampulla. So relaxation of the sphincter of Lutkins as well as the, you can say, ampulla. So you know we have spiral valve of Heaster and the sphincter of Lutkin. The moment the sphincter of Lutkin is relaxed, the bile should flow into the CBD, and now the ampulla has been relaxed, and that is why it should move out. But due to certain reasons, the very important reason for this is a vagotomy or a poor neuronal, you can say, functional status of this patient. So because of this, there is no stone inside, but still the gallbladder is not able to empty itself, and that is why the over distended gallbladder is going to result in the lot of problems. So there are a lot of people who used to say, okay, if you have a lot of you can say a lot of acidity, that is again related to this. Remember, you go for an ultrasound, nothing is there, and then you keep on doing upper GI endoscopy, trying to search for the ulcers and this and that. Let me tell you, this is what is very, very, very important. How to diagnose the functional gallstone disease. Today we have a criteria for that. And what is the name of that criteria? So we have the Rome 3 criteria. So what is the Rome 3 criteria for functional gallbladder disease? The first is pain. This is what is important. So pain along the epigastrium, this is what is important. So pain along the epigastrium or the right upper quadrant. So patient is complaining, doctor, I have pain over here as well as here. The very next thing is this gallbladder dyskinesia? No, not at all. Along with that, all of them. What are all of them? This is important. All means all. एक भी point skip नहीं होना चाहिए. The duration. So the duration of pain should be at least more than equal to what minutes? 30 minutes. So pain over the epigastrium lasting more than equal to 30 minutes. Along with that, plus. Location I have told you. Next is it should be recurrent in nature. So pain is there, duration is there, recurrent in nature. The next is the pain presents itself and goes to a steady level, after which it will decrease, after which it will start to fall. So attains a steady level or rises to a steady level, after which it will always. Why this is? Because there is a capacity of gallbladder distension. After that, it has to get forceful opening. The next is apart from this. So attains a steady level. The pain, when you talk about the intensity, so we have seen the chronicity, we have seen the timing. So intensity, very important. So intensity, moderate to severe. Remember, affecting the quality of life. So how do we define the pain? Pain is subjective. So affecting the quality, the patient is concerned about this pain. So pain is there. Pain is usually lasting more than, you can say, 30 minutes, recurrent in nature, attains a steady level, and apart from that, no change with posture. This is important. So patient tries to sleep, patient tries to walk. लोग कहते हैं ना कि भाई थोड़ा सा चल फिर लो, the pain will reduce, कोई फर्क नहीं पड़ता. So no change in posture, no change in, you can say, with bowel movements. There is no change with the bowel movements. Many of the time people say that okay, this distension is because of the postprandial bowel distension. Along with that, no change with antacids. This is what is very important. So antacids you take, there is no change, and along with that rule out structural anomalies. So rule out any structural you can say defect. So if all these points are satisfied, remember this is what is functional gallbladder disease. 90% of the people even don't know what is the criteria for this. When we talk about this, what is the investigation of choice? Always remember, first of all, it's a HIDA scan. But when will you go for HIDA scan? Remember, gallbladder dyskinesia is, or gallbladder dysmotility, or the functional you can say gallbladder disease is a diagnosis of exclusion. This is what is really important. So it's a diagnosis of exclusion. ऐसा नहीं है कि patient आपके पास आया, उसको gallstone नहीं है, but patient is having the complaint of you can say dyspepsia, and you say okay, I'll go for cholecystectomy. To avoid unnecessary cholecystectomies, there is a very strict consensus, that is the Rome's 3 criteria. And remember, what is the management? Yes, you will have to go for cholecystectomy. So this is very important, how you diagnose this functional gallstone disease and how you manage. So we cannot rush for the management.